There is no doubt that in India, we are in the midst of a major heart disease epidemic. Almost 1 in 4 Indians die of cardiovascular diseases.
And Samir, we have spoken about this many times on why it happens. But the biggest question is, what can we as a person do to reduce our risk?
That's a great point. And my patients often ask me that. And I always tell them, one of the most important things that you can do to reduce your risk of heart disease is exercise. As a cardiologist, I cannot stress this enough. Exercise. And when I say exercise, I just don't mean go out for a stroll or for a walk. I actually mean exercise and workout.
And that is why today, let us look into what is effective exercise and what are the benefits that you can get out of it. I'm Dr. Sonia Gupta.
And I'm Dr. Sameer Gupta. And welcome to Doctors on Call.
The international medical associations and even the Indian guidelines recommend at least 30 minutes of moderate intensity aerobic activities at least 5 days a week or 150 minutes a week, or at least 25 minutes of vigorous aerobic activities at least 3 days a week or total of 75 minutes a week. Now when you exercise at the right pace, your heart rate increases, your breathing rate increases and you start sweating. In low intensity exercises like, say for example, walking at less than 3 km per hour would not really cause much of a discomfort in most people. In moderate intensity exercise, you would see an increase in heart rate and your breathing rate, while still being able to talk comfortably. An example of moderately intensive exercise would include walking between 3 to 6 km per hour on firm ground, cycling at less than 16 km per hour, cleaning the house and gardening. Vigorous intensity exercise, on the other hand, further increases your rate of breathing, such that you may find it difficult to talk for more than few sentences without stopping and taking a breath. Vigorous exercises include jogging, walking a kilometer in less than 10 minutes, aerobics and jumping rope.
Let us see what some of the doctors have to say about the benefits of exercise.
So remember, sustained exercise which you are going to follow for a long time is the main answer to prevent diabetes and the cardiovascular complication. Along with the exercise, if we don't say be regimented dietary schedule, means an ideal diet should be accompanied by a good exercise program. With this, my message to the audience, the listeners, from today, take a pledge that if anybody in the family is having diabetes, if you're obese, if your waist circumference is high, if you lead a sedentary lifestyle, if you smoke, if you take alcohol, let's start from today. A small beginning is going to give a long way in preventing diabetes and its complications.
Now, it is a very well-known fact. It has been researched and proven that lifestyle change, with exercise being the main pillar, it can reduce your incidence of diabetes by about 58%, and very few drugs can actually rival that. It is the cheapest and the most cost-effective, side effect-free way of stopping yourself from becoming diabetic and having heart disease. Exercise makes your insulin work better. So if the insulin works better, your blood sugar stays down, your muscles get toned up, your blood pressure stays good, and that will prevent heart attack and other complications of diabetes. Now, by exercise, many people think that they have to go to the gym, or they have to go to the swimming pool, spend money, or they have to run or jog in the hot sun. That is incorrect. All you have to do is at least 150 minutes of exercise spread out throughout the week.
Apart from quitting smoking, exercising is one of the best things that you can do to reduce your risk of heart disease and improve your overall health.
Make sure it is effective exercise. Start slow and slowly build your stamina. Also remember not to overdo it.
Another important point, always talk to your doctor before you start an exercise program.
Well, that's all for now. See you next week.